Hello, my name is Eric Verho. I'm a student at CUNY Lehman College, and I've done my internship at Riverdale Physical Therapy, where I've completed a total of 120 hours. In today's presentation, I'm going to talk to you about ACL tears, especially in young athletes, and return to play guidelines. The ACL is an abbreviation for the anterior cruciate ligament, which is situated between the lateral cruciate ligament and the medial cruciate ligament, MCL and LCL. It's also anterior to the posterior cruciate ligament, the PCL. The ACL connects the femur to the tibia. Now, what people tend to forget is that ligaments and tendons are actually very different from each other and have big differences. The main difference of which is that ligaments are much more elastic. The ACL is actually one of the most common non-contact injuries in sports, especially to the lower body. It's very common in sports such as football, basketball, tennis, even pickleball, anything that has huge change in directions. People who have suffered from an ACL tear have all experienced hearing a popping sound, right? It's just something that people have all said they've dealt with at the time. And it's actually, fun fact, more common in women rather than men. Now, a complete tear of the ACL is a lengthy recovery, right? When you completely tear your ACL, you go through a surgical procedure known as the ACL reconstruction surgery. So the full recovery time, right, from normal standards, is between 6 to 9 months. Now, there are certain things that will either determine you going through a longer process or a shorter process, but that's based on things we'll get to later. An athlete is typically able to resume their sport after a full recovery without any long-term effects or long-term injuries if they've gotten proper care. However, there's a lot of time lost, right? 6 to 9 months or even more so is a lot of time lost in a sense, where if an athlete's preparing for, let's say, a draft or a final game or a championship, right, that time lost can be detrimental to them. It can give them a lot of mental health issues, depression, and, it could result in weight gain as well. And also, it costs an arm and a leg to get the surgery if you don't have insurance. So that's another kind of setback in a sense. So like I said, I'm pursuing my degree in physical therapy. So this speaks to me in its own way because this is one of the most common reasons people are going to physical therapy, especially young athletes, is due to ACL tears. I myself have torn my meniscus and damaged my ACL, but I've also worked with a ton of people at my job who have had total ACL tears and going through ACL reconstruction. So I have a lot of experience in that way. Physical therapy you have to do it. If you go through the surgery, you have to do physical therapy because you're not going to get a full recovery. Now, the quality of therapy is also very important to this step because having a therapist who might be more neglectful, like I said, can determine how long you stay. So 6 to 9 months, if you're not getting good quality care, you can be there for up to a year. Also, they have athletes who have not even gone through therapy, me myself, and I still feel knee pain along with others 3 to 5 years later. So definitely the therapy is a big part of it that everyone just needs to go through. Also, right, for longevity reasons, physical therapy gives a good amount of attention to mobility and flexibility and stability, all of which can help prevent any further sort of damage or any further injuries after full recovery. Now, physical therapists look at things called protocols. Protocols are given by certain websites, certain studies, schools, hospitals, right? But they're prescribed by a doctor. Each protocol has phases in a sense. Every protocol is different, just like every patient is different. Some protocols, I've looked at a few from the Hospital for Special Surgeries, a study from Ohio State University, and one from Massachusetts as well, right? All of which have had very similar guidelines, but different phases. It becomes a sort of ladder where you need to complete one phase before you move on to the next, right? And that's where that 6 to 9 months typically falls into. It's not a set time. According to this specific study from the Hospital for Special Surgeries, there are 5 phases that we are going to look at today. So every protocol we are looking into is going to have goals, right? Goals and different criteria that needs to be hit before moving on to the next phase. So, first phase after post-operation is phase 1, and it's between weeks 0 to 2. This phase emphasizes on patella mobility. Patella is the kneecap. Full knee extension, and improving quad contractions of the quadricep muscle, as well as controlling overall pain and swelling. So, after ACL reconstruction, muscular atrophy on the affected leg is very sudden, and some people have reported up to 20% atrophy. So, being able to get back that feeling of being able to contract the quad is crucial, and it's a crucial step to do as soon as we can. So some goals for phase 1 would be full passive extension, right? And a minimum of 90 degrees flexion. We would try to normalize the patella mobility after being in the brace for a while. Progressive weight bearing, not full. Full weight bearing would come at a later time. And prevent inhibition of the quadriceps. That would be, we call it lag in a sense. So there are certain lifts that we do where we can tell if the quadriceps are being activated or not, right? Because there's certain movements that the quadriceps are responsible for. Some precautions in this stage include avoiding direct heat. Now, in physical therapy, everyone always hears heat, stim, heat, eat, stim, heat, eat, stim. But for phase 1, in this case of 0 to 2 weeks, we definitely don't want that. We actually recommend more of a cold therapy, cryotherapy, ice therapy, whatever it may be. This helps with swelling, this helps with pain, and also if there's any edema that have been like added onto from any like side quad track or anything like that. And we also want to avoid prolonged standing. Standing for a long time, although sometimes it's not easy to not stand or do your bodily functions, it takes a toll on the knee as well, especially if it's freshly off surgery. Exercises in this phase are done with the brace still locked in, right? Single leg raises are for one, where a patient is supine and one knee is bent and they're lifting up a leg at once. It's exercise for the quads. Bike is also available to do, like we could do bike at a slow, moderate pace. These are all things that'll work wonders for the knee at this time. Athletes are able to move on to phase 2 only and after only being able to do the SLR raises, as I spoke, without lag from the quadriceps. If they're able to achieve 0 degree extension and at least 90 degree flexion. And their ability to demonstrate pain-free unilateral weight bearing, right? And this is more so focused on the affected leg. Oops. All right, moving on to phase 2. Phase 2 is between weeks 2 to 6 after the operation. This phase is emphasizing on normalizing knee range of motion and patella mobility. It also minimizes knee effusion as well as normalizing gait patterns, which is often overlooked, right? No one thinks, okay, I need to learn how to walk again after getting out of surgery, right? They think it's like riding a bike. You'll learn it again, but it's going to take some time. So in this phase, the Hospital for Special Surgeries has a protocol include having a range of motion to up to 125 degrees in flexion and 0 degrees in extension. Now that is a substantial amount more than where we started, 125 to 90. That's 35 degrees extra. Improving the patella mobility and minimizing the swelling. Restoring normal gait without assistive devices, crutches, walkers, whatever the patient or athlete has been using. And being able to ascend 8-inch stairs with good control and without pain. Now, some precautions would be to avoid descending stairs, right? We have not been working on the eccentric load yet, right? Which actually tends to be more difficult in this sense and will cause a lot more pain. Just overall avoiding pain throughout any of these steps is a huge precaution that we should take. So, in order to move on to phase 3, there are some minimum criteria to meet. Again, we need to be able to hit from 0 to 125 degrees, for sure, in terms of the knee range of motion. We need to get to a normalized gait pattern for walking. We need to be able to ascend that 8-inch step. And there's going to be functional progression pending functional assessment. This is going to be sport specific, right? So if there's certain movements in your sport or activity, you're going to hear this one come a lot throughout the phases, but it's going to be progressive as well. Any movements that are in your desired sport or activity, we're going to test them as well. So phase 3 falls in between 6 to 14 weeks, right? This is a good amount of time after surgery. This phase is when we start looking into rebuilding that strength in the quadriceps that has been lost and atrophied, all the muscular atrophy and the strength that has been diminishing over time. This is where we're starting to really rebuild it, right? And now we're going into eccentric quad control. Now, Ohio State and the Hospital for Special Surgeries has set the following protocols. Now we need to restore full range of motion, and we will do this by comparing the normal levels. We need to be able to properly descend the 8-inch step pain-free and improve overall lower extremity flexibility. And we also need to protect the patellofemoral joint. In this phase, squats, leg press, as you can see in the photo, are finally being used, right? And incorporation of small, light agility drills such as a Bosu ball, small step-ups, things like of that sort. In this stage, we also want to prevent pain, and we don't want to resume sport activity until medical clearance. So, to move on to phase 4, we need to improve the range of motion, right? Maintain control in descending step, and again, the function progression. Excuse me. All right. Phase 4 is when athletes start to proceed into more athletic and sport-specific training. Some goals set by the protocols I've used have been to demonstrate the ability to run pain-free, maximize strength and flexibility, and we'll do a hop test where we're looking for either greater than or equal to 75% limb symmetry, really working on that atrophy that we were speaking of before. In this phase, the treadmill is permitted, and we're also adding things such as plyometrics into the equation. These, of course, have to be pain-free, and the athlete still should not resume sport unless medically cleared. Now, before advancing onto the last phase, phase 5, the athlete must achieve symptom-free running. That means pain-free and full comfort. The hop test has to have 75% limb symmetry and, function progression based on specific movements in the sport. And it's between weeks 14 to 22. Phase 5 is between weeks 22 to so on. It could be whatever it is until the patient is ready to be discharged. Now, in this last step, right, we are looking to minimize a lack of apprehension with sport-specific movements, right? We need things to be completely set in stone, right? Nothing to be lagging behind in terms of movement. We need to maximize our strength and flexibility to meet the demands of the sport. And for the hop test, we're looking for 85 or greater percent symmetry. Now, we're continuing the same thing as the phase 4 strength and conditioning and flexibility program, just raising it to a notch above. Now, those goals that I mentioned have to be met before reaching on to the actual discharge of the patient. Now, every patient is different and the amount of therapy needed. Now, like I said, the norm is between 6 to 9 months. However, some might need much more time than that. Many other protocols, like the Ohio State one, have it up to 40 weeks, right? But everyone is different in a sense. It's just based on how much quality care and how much they keep up with the care. I'd like to take this opportunity to thank Dr. Gleb Kartsev for being my mentor during this internship process. I've learned a lot from him, as I have learned a lot from my professors at school. Thank you.